check is proudly brought to you by First Capital Bank. Belief comes first.
Alrighty, welcome to the health check with Dr. Bhagat and myself, Zuzue Mavuma. And today we are talking all things poop. We're running a bit late, Dr. B, so take it away.
I thought you didn't want to talk about it. That's why you didn't want to put.
Oh my goodness. But you know me, Dr. B, I love nasty things.
So do our audience. We got lots and lots of questions. I think we need to keep these topics really interesting. And the most important thing about poop is people need to talk about it. You know, we talk about the color of our pee, and we talk about, you know, the complexion. We talk about our fingernails. But you've got to talk about your poop because the intestine is literally your second brain.
Yes.
It is your poop can actually tell you so many things about your health that you may not actually be aware of. And so the first thing and the bottom line here is inspect your poop on a regular basis, because you want to make sure number of things, what's the texture, what's the consistency, is it hard or lumpy and bumpy, is it sausage like, is it cracked, what are the colors, you know, it may sound gory, but these things actually tell you how the bowel is functioning. And the bowel is replete, which basically means it's full of, bugs and enzymes and juices and minerals. And if you're not producing enough of any of that stuff, your food is not digested. When your food is not digested, it comes out in your poop. So the most important thing is that there are different types of stool or poop. And those that are unfamiliar about talking about this, please don't switch the channel.
Station.
It's really important. So if you have separate hard lumps like nuts that are difficult to pass, this is important because it means you're generally constipated. If it's sausage-shaped and lumpy, it's a healthy size. If it's sort of smooth and snake-like, if you like, I thought of that word, it's also very good. If it's small, soft blobs that float in the toilet pan, it means that you're not digesting properly.
Okay.
This is really important. In terms of the color, basically brown color is a normal color. If it's yellow, it tends to suggest that you're having a poor absorption. You may have an infection, you may have malabsorption, you may have something wrong with your pancreas. If it's sort of yellowish, clayish or whitish, it generally means you have a liver problem and there's something wrong with your liver and you need to go and see your doctor. And if it's black generally means that you're bleeding, because it's not the fresh blood in the poop that frightens us doctors. It's if a patient says, my stool is so tarry, black and sticky and really offensive in smelling, what's happened is that you've bled from somewhere, that blood has digested into this black color and it comes sort of gooey. So if you've got black, that's a warning sign that things are important. I'm going to go straight into some of the questions because they're really interesting. Somebody says, Naka, I actually poop small little balls. What does this mean? Pebbles or pebble bowel movements aren't usually a reason to worry, but they may mean the stool is moving through your intestines at a very slow pace because you're not drinking enough water, and it's generally a sign of constipation. Somebody's asked you, what color is a healthy poop? We've talked about that. All shades of brown, and sometimes even a wee bit of green is fine, but not yellow and not white and not definitely black. Somebody's asked a strange question, but I thought we'd answer it. It says, how often should a woman poop? Well, you don't need to poop every day, but every day is very good and it should be regular. Generally, most people should poop every day, max minimum 3 to 4 times a week. If you're not emptying your bowel more frequently than that, then there's a problem. Somebody has asked me, which we've answered, what causes white poop? Generally, bile is a digestive fluid produced by the liver and stored in the gallbladder. Now, when the stool gets its normal brownish color, it comes from that bile that comes from the liver. So if the poop is white, it basically means the liver isn't producing bile and there's something blocking in your liver. So that's really important. Somebody's asked an interesting question, which is a very important one, and that is your poop supposed to sink or float? It's supposed to sink in the toilet. Floating stools are generally an indication of a high fat content, which can be a sign that you're not absorbing the fat that you're eating, and that's causing your poop to float. Somebody's asked an interesting one also, given our lockdown and COVID era, can you get COVID from stool? And that's a really interesting question. I had to actually look that up. And a new study has shown that COVID virus has been isolated from the stool of sick patients and can infect cells in a petri dish in the lab. So this is research that is stepping forward to prove possibly a new route of transmission. So that also worries them. So that's really important. What does yellow poop mean? It basically means that it's usually due to dietary changes or food color. Sometimes, if you eat beetroot or if you eat some sort of really strange color, and it changes the color of your poo, so don't panic too much. Somebody's asked, what is a grey poop? There are lots of colors coming out today. If stools are grey, generally means the patient has some sort of digestive issue, and that's really important. So these are really important issues because they really do tell you what's going on. We did mention it last year, but I must tell you that it's now made progress, and I think I got a bit of a laugh from you. The Japanese are experts at manufacturing really fancy toilets, and they've come out with a toilet.
Yes, I've seen that.
Yeah, they've come out with a toilet that actually is suited to you, so it knows what Zoo's poop is normally like. So the moment it changes color, there's blood in it, or there's a different pH, or it's too acidic or too alkaline, it lights up to say there's something wrong with your gut, go and check with your doctor. So this is going to be basically a homemade testing at another level. So this is really important. Somebody's asked here, how long should you sit on the toilet? Well, it depends whether you take a magazine or not into the toilet, but generally it should not take more than 2 to 3 minutes to empty your bowel. If you spend more than 10 minutes, there's a problem.
There's a serious problem
in terms of your bowel. So how do you make sure your poop is normal, somebody asked? Well, that's the best question to ask, and that is drinking lots of water, making sure you have lots of leafy greens and fiber. Fiber moruku, we talked about this endlessly in other programs, but eat your morojo and your dinawa, eat your lebelebele and your korong. Okay. These things are really good for the gut with lots of water, generally between 1.5 to 2 liters of water, not juice or squash water, will make sure your bowels move regularly. If you're not moving in spite of all of this, you need to go and see your doctor, because it really does tell us something is wrong. And often, unfortunately, people come so late that we find they've either got some sort of growth or they've got gallbladder stones, or they've got sort of an infection that's going on, and they've left it too late. So that's really important. Somebody's asked about.
Wait, Dr. B. Let me quickly do this, and then I'm going to put you back up. So don't go anywhere, please.
Okay.
All right. So we're going to hold on, finish up with Dr. Bhagat. But for now, let's get into some ads. All right. We're going to finish up with Dr. Bhagat as we close up the poop conversation. Hi, Dr. B.
Well, I'm going to answer a couple of questions. They're really quite fun, and they're important. Somebody's asked, what if my poop is really, really smelly? Well, whoever sent this in, poop never smells like a bouquet of roses. But if your poop really stinks, then it's probably likely due to an infection or a stomach bug that's going on. And if people are complaining that this thing is permeating the house, you need to make sure you've not got an infection. Somebody's asked here, what about diarrhea? Diarrhea is always an issue, Zoo. If your stomach is running, it either means you've eaten the wrong foods, you're intolerant of certain things, or you've got an infection. So if your stomach is running, your bowels are trying to empty something from them that is not agreeing with them, whether it's an infection or whether it's sometimes it's milk. People drink milk to actually flush their bowels. Yes. Or you've taken an antibiotic that's killed the natural good bacteria in your system and is actually caused upset. So if you have a running stomach, it's really, really important to make sure. Let me just wrap up by talking about the most important things we've talked about today. One is make sure that you examine your poop. What's normal, what's the size, what's the shape, is it firm in consistency, what is the color, and how frequently are you going. Those are the most important things about timing and why poops are really important. Determining your health.
Okay. Well, I wish we could have dug a little deeper. You know me. But I'm so excited to talk about our next session, which is on breathing.
Yeah, we're going to be talking about the art of breathing. Why everybody says, well, everybody breathes. What's the big deal? Well, I'm going to show you how important we've discovered the art of breathing is. People don't breathe properly. They breathe through their mouth. What's important about breathing through their nose, the different types of breathing, and how it can actually powerfully influence the way you feel on a day-to-day basis.
Dr. B, you are speaking my jam. I'm so ready. All right. Have a great Sunday.
Thank you.
Bye.